A trifecta of infections, RSV, influenza, and COVID-19 are expected to circulate in the United States over the next few months. And now to COVID specifically, with cases once again going up across the U.S. Now, experts say the new Aris variant is to blame.
Yeah, and ABC15 data analyst Garrett Archer and reporter Lustelia Caballero teaming up tonight for you to show you Arizona's COVID reality.
For many, it might feel like COVID is in the rear view mirror, thinking about things like tissues, test kits, masks, and more. But health experts say a new strain of the virus might be bringing some of that back.
We are starting to see a new subvariant called the Aris variant.
A variant that's relatively new to the United States.
And absolutely new to Arizona.
Dr. Andrew Carroll, a Valley physician at Tempest, says the symptoms seem to be the same as previous variants.
It's that head cold, severe sore throat, the cough, congestion, drainage, fever, body aches.
Though he says there are some notable differences.
We aren't seeing as much of the loss of sense of taste or smell, which is good. And we're also not seeing the severe pneumonias like we used to.
So he's hopeful this now dominant strain won't be as severe as previous ones. The likelihood of containing the spread, though, well, that's a different story.
How contagious is this variant?
As each new subvariant of COVID comes along, it will probably be more contagious. That's kind of the nature of viruses.
For a closer look at Arizona's current COVID reality, my colleague Garrett Archer is here to go inside the numbers.
Thanks. About 3,500 COVID-19 cases reported by the state health department this week, about double the weekly number we had during any given week in June. But mass testing is a thing of the past, so taking a look at wastewater surveillance will give us a better idea of COVID-19 prevalence. Plants in La Paz and Yuma County stand out here. Data shows that the most recent testing in La Paz found COVID-19 concentrations at about 87% higher than in any previous test. In Yuma, it was about 51%. All other tests, Maricopa and Pima water plants, seeing much lower numbers compared to past testing. Hospitalizations can also be a decent indicator. And after a seasonal bump that peaked in December, it's generally been on a downtrend. That being said, we are starting to see an increase here again. 209 COVID-19 hospitalizations across the state this past week. That's a 38% increase from the previous week. And finally, a look at COVID-19 deaths. And while this is always tragic, there is some good news here. Deaths have been near or below 20 per week since the beginning of June. Fewer than 1,000 deaths are attributed to COVID-19 this year. That's a decline of 83% for January to August of last year, which itself was down a third from the pandemic's deadliest year of 2021. Luz Delia?
Thanks, Garrett. One other thing to think about, new COVID boosters are expected to come out next month and will be available for virtually all children and adults.
Well, in that way, once it's in your system into October and November, as we start to gather for Halloween and Thanksgiving and our Christmas and Hanukkah holidays, you'll be well protected.
Lustelia Caballero, ABC15, Arizona.